every day a mother, a sister, a daughter, or even a brother faces a silent battle, breast cancer. It is not just a disease, it is a story of strength, courage, and survival. But the truth is, when caught early, breast cancer can be defeated. As always, you're welcome to the program Your Health, where we look into different health issues, healthy living, and timely actions. I am Salamat Uziomaluka. Stay with us as we bring to you the benefits of this fruit as they may prevent cancer. I'll be right back. They said food is medicine, and nature has given us abundance of healing treasures. Of course, while diet plays a role, understanding medical side of breast cancer is key. To make us and help us, understand it better, we have Dr. Miriam as she tells us what breast cancer is, causes, prevention, and management.
Just simply put, when the cells of the breast begin to grow abnormally, in abnormal proportion, and becomes and starts to spread around the whole tissue and starts to take over the normal cells. So that's what a cancerous condition is all about. And then when it happens in the breast, that's breast cancer. Breast cancer affects both male and female. As long as there's breast tissue, cancer can come in, and then the person has cancer. So right now we begin to see breast cancer in males. Prior to that, we only used to see a female. We used to always hear about females, but right now we begin to see breast cancer in males too. Breast cancer can occur especially in the middle age range, and or earlier if there's a risk of breast cancer. Talking about risk of breast cancer, if someone has a genetic predisposition to breast cancer, I'll explain. Imagine my mother has breast cancer, and maybe her sisters may have also had breast cancer. There's an increased risk of me having breast cancer, maybe early enough than I would have if I did not have those risks. So the age at which it occurs depends on the risk factors that are present at that point in time. Lump in the breasts is one measure. That's why females are advised to always examine our breasts. Now, dimpling of the skin of the breast is very, very important. Now, an ulcer on the breast that doesn't heal is another fact. It's another thing. Now, bloody discharge from the breast is also another symptom. So when you see all these things, or even the hardening of the lymph nodes in the armpit region, you have to go to the doctor as soon as possible so that you can get evaluated for breast cancer. Self-examination, you stand in front of a mirror, unclothed, as a female, and then you raise up as in one of the hands, and then use the other hands to palpate every section of the breast. Divide the breast into 4 sections. Palpate every section, the 4 sections of the breast around, and feel for any lump. And then when you're done with the 4 sections, you move to the armpit region and you palpate. Then the same thing you do. You lift up your hands, or you put your hands behind your head and do the same for the left side of the breast. One is expected to do it at least before you have your bath, or maybe after you have your bath. It's very, very essential, especially if you have a risk for breast cancer. Once you are 40 years and above, it's expected that you examine your breast regularly. We have the benign one and the malignant one. The malignant ones are the ones we call cancer. While the sometimes people can just have a lump in the breast, that could be a fibroma or an abscess or a lipoma that can just be removed. Those ones are just benign. They don't grow aggressively. Where we say cancer is when the cells of the breast starts to grow aggressively, far beyond their boundaries, into other tissue, replacing the normal tissues, and even far beyond to other organs. So you see, in breast cancer, the cancerous cells spread from the breast to the lymph nodes down to other organs, even the chest and all. So it is usually very aggressive. Once we see aggressive spread of any abnormal cell, then it's a cancer. Basically, lifestyle is a risk factor. We'll talk about cigarette smoking. Alcohol intake is also very important to rule out those risk factors. Now, another risk factor could be genetic, like the presence of the BRCA1, BRCA2 gene in an individual would mean that the patient is at high risk of having breast cancer. So normally it's expected that patients with such genes should therapeutically remove their breasts. A lot of people out there do it. They therapeutically remove their breast, because when there's no breast tissue, of course, and you have the gene for breast cancer, there won't be any breast cancer. A benign disease that just becomes malignant. And then exposure to radiation, exposure to radiation can also be a factor, for breast cancer. There's some of the factors that may even be idiopathic. We may not even be able to, pin on that this is a factor that could have caused this breast cancer. Now, another thing is the use of hormones, especially in women that are already postmenopausal. They need those hormones for their vagina to, for their cycles, for them to feel better during menopause. Those hormones can actually be a risk factor for breast cancer. The use of contraceptives, I don't think there's any research that I've seen that will say increasing the use of contraceptive is a risk factor for breast cancer, except if the person already has the risk of breast cancer already. Lower your chances by living healthy, examining your breast regularly, carrying out, it goes beyond just examining your breasts. Now, once a woman is 40 and above, it's expected that you should have mammogram at least once a year. Mammogram is like an X-ray that scans the breast for nodules that could suggest, the breast cancer. Now, the problem is not even having the breast cancer. The problem is finding it out early so that it can be treated before it becomes very dangerous and spreading everywhere. And if found early, better. Person can live a very long life. But if found very late, the prognosis is usually very, 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 very bad. Yeah, so early detection, regular breast examination, and mammograms, those are the ways you can prevent. It is not, it all depends on a lot of factors too. You understand? It may be slow spreading depending on the type of cancer itself. There's some cancers that are really, really very fast spreading. They're the ones that are slow spreading. So it all depends on type of cancer and also the immune response, your immune response to it. You understand? So I can't say, hey, it takes so time before it starts to spread. There are a lot of factors that could determine how long that will spread, and the cancer cells will spread. But most importantly, once you're diagnosed to have breast cancer, or you have a suspicious lesion and all that, there are measures to slow the spread of that cancer, or stop the spread of cancers and all that before it becomes deadly. Breast cancer, early detection is key. So if you do your self breast examination and you find a suspicious lesion, or you also find, sorry, I forgot to mention, while doing the breast examination, the last part of it is to press out the nipple for discharge. Press the nipple for discharge. Sometimes, that's very, very key. Now, if you find out that your nipple is discharging something abnormal, the breast is dimpling, there's a nodule somewhere and somewhere, quickly get it checked as soon as possible, because most of those nodules are like lesions that could lead to, that are the pre-invasive lesions that could progress to the cancerous lesions. You understand? Now, if found early, it can be removed, or the breasts removed, depending on how far the spread has gone. So it's very, very important as women to always examine, even men, examine your breast regularly. If you find anything, go to the hospital and get it checked as soon as possible. Now, the major challenges we have with breast cancer management basically is the belief system and the health-seeking behaviors of Nigerians. I've heard a lot of cases of people who have died as a result of breast cancer. And when you ask questions, is that, oh, I heard I had breast cancer, I went to the doctor, and the doctor said I want to my breast should be cut off. And then I'm saying, no, why should my breast be cut off? And then we go to the prayer houses and start to pray, and at the end of the day, the cancer progresses and the person loses his or her life. For me, I feel that is not an optimistic way, of handling such a situation. Now, if you found to have breast cancer, you can actually live without your breast, because right now there are actually artificial breasts that can help you even come out and still be fashionable. There are people who out there who don't have breasts and use the artificial breasts, and they come out and they're fashionable. They wear their clothes and they get fitting. Until you tell somebody you have an artificial breast, the person will not know. Life is beyond having a breast. Without your breast, can still live. So once the cancer has spread to the breast and it is expedient that the cancer cells are removed, please subject yourself to that treatment so that you can live long to achieve what God has planted you in this life to achieve. So that's one thing. Now, there are different modalities of treatment. I've indirectly talked about most of the surgical removal. There's chemotherapy, there's radiotherapy. All these sometimes go together or, separately, depending on the level of spread of the cancer cells. You understand? Now, if the cancer cells, have gotten to a very late stage, there'll be a combination of all of them. Both the surgical, the chemotherapy, and the radiotherapy at late stage. And we have a lot of breast cancer survivors, people who survive it, even when they get to very late stage. Most people tend to survive, and then when you hear from them, you hear that what helped them to survive is they had to change their routine lifestyle measures. They had to switch to healthier, source of food, lots of fruits and vegetable, they removed all toxic form of chemicals from their diets, They also made sure that they are in a happy place, because the mind is also one factor, because we thought there's a hormone that's released when one is happy. Serotonin actually helps to boost the immune system, and can actually suppress some of the cancer cells, from growing ravagely. So that is also very important. The mindset of one who is in treatment for cancer, very, very important, and mindset is good and clear. Then you go through your treatment processes. There are medications that they are placed on. Take your medications regularly, to ensure that that you achieve cure. Go for your regular checkups they're supposed to go to. Even if you want to pray, while you're praying, you can still be, going for your medications, your tablets, and all that, and your radiotherapy, until you're declared cured, from the breast cancer. Survival rate from breast cancer, it's high. If all it takes is early detection. If detected early, is high, but if not detected early, of course, the prognosis is usually bad. So early detection can actually, most people survive from breast cancer than every other form of cancer. Ovarian cancer, most of the time, is when you start to have symptoms that people get to know, or maybe it's dental finding. Somebody goes and does a scan. But breast cancer, it's easy, especially when you're carrying out your self-breast examination. You're looking at your breast regularly and all that. It's easier to detect early, And then the problem now becomes taking action to actually remove that cancerous cell. That is where the problem lies, because most of our people drag their feet when it comes to taking action. So our health-seeking behavior is really, really poor. That's why we have a lot of persons, dying from breast cancer, because we seek the available options very late, and by then, most of the time, there's hardly much that anybody can do, because by then, most of the cancer cells have spread all over the body.
Dr. Miriam, knowledge truly is the first step to protection, but knowing how to act is just as important. Like she said, early detection is key. Now let's look at how the simple demonstration can help us with early detection.
To feel for changes in your breasts, underarm, and collarbone areas more accurately, do so by lying down, because the breast tissue spreads out evenly across your body. This makes it easier to feel for lumps. What you should look out for: a lump, swelling, or thickening in the breast or underarm area. Any enlarged lymph nodes at the underarm and above the collarbones. Lying down. How to examine your breasts when lying down. Elevate your right shoulder by placing a folded towel or pillow underneath. Extend your right elbow outwards and place your right hand under your head. Use the pads of your 3 middle fingers and apply pressure to feel your breast tissue in a circular motion. Use 3 varying pressure levels, light, medium, and firm, to feel for all the breast tissue from the skin level to tissues closest to the muscles and ribs before moving on to the next area. Examine the whole breast systematically in a clockwise or anti-clockwise direction. Press down over your nipple with 3 varying pressure levels in a circular motion. To check for lumps at your underarm area, put your arms by your side. Start in the hollow of your underarm and move towards your breast, making overlapping small circular motion. To check above the collarbone, use light pressure and move in a circular motion. Repeat the same steps on your left side. How often should you perform breast self-examination? The best time to perform a self-examination is about a week after the start of your menstruation. It is more effective to perform on the same day of each month if you are no longer menstruating, pregnant, breastfeeding, or have breast implants. It is important to understand that breast self-examination can complement breast cancer screening, but it is not a substitute for it. Most lumps or changes in the breast are not cancerous, but as a precaution, it is advisable to consult a doctor as soon as possible.
That was a graphic demonstration of self-examination. Here are some health tips on breast cancer. Do take a watch and we'll be right back. Those are powerful reminders that healthy choices today can protect us tomorrow. Remember, prevention is always better than cure. Up next are some eye-opening facts that you need to know about breast cancer. Those were some facts you need to know on breast cancer. We'll take a quick break and we'll be right back. Welcome to our feedback segment. Here we take your questions, comments, and suggestions. And of course, you can always be part of this segment by sending your messages to the numbers displaying on your screen. Our first question today is coming from Mr. John Emmanuel from Gariki, Abuja, and it goes, he's asking, how can I meet with your doctors? Well, Mr. Emmanuel John, we have different doctors for each episode of our program. If you're able to tell us what the particular health issue is or the doctor's name, we'll definitely get you to say the doctor. Our second question is coming from Lamidi Lasisi from Gariki, Abuja, and it goes, thank you, presenter, for the health discussion you take every week. I gained a lot. Well, thank you, Lasisi, for your words of encouragement. We'll definitely try to bring you more health information and, of course, on how to stay healthy. These are all we'll be taking on our question and answer segment. Let's go on a quick break and we'll be right back. Breast cancer is not a death sentence. It is a call for action. Awareness, early detection, and healthy living are the keys to survival. Share today's message with someone you love because today we can save lives. Until next time, remember to stay healthy. Bye for now.